A systemic review of maternal well-being and its relationship with maternal-fetal attachment and early postpartum bonding. Pregnancy and the transition to parenting is a time of rapid physiological, psychological, and social change, which can be challenging and stressful for mothers. International research shows that the antenatal period can be associated with increased distress and elevated psychological vulnerability, leaving women susceptible to mental health difficulties, that is, symptoms that can cause significant distress and impaired functioning. Recent studies show that the clinical indicators of depression, anxiety, and stress are common during and after pregnancy, and that comorbid mental health symptomatology is prevalent. These experiences may have a cumulative impact on the individual's ability to balance psychological, social, and physical resources with life challenges and stressors, at times referred to as well-being. Maternal distress has been found to be associated with poor obstetric outcomes and impaired cognitive, behavioral, and emotional child development. Some studies have found that distress is higher during pregnancy than in the period following it, while other research suggests that a stable pattern of symptoms exists across antenatal and postnatal periods. Effective antenatal screening could both identify women with mental health problems during pregnancy and serve as a marker for those who may be at risk of continued distress post-childbirth. During this period of transition and psychological vulnerability, the origins of attachment relationship between a mother and her child begin to emerge. It is well recognized that early attachment relationships play an important role in a child's psychological, cognitive, and social development. The attachment relationship between formed with their primary caregivers during infancy and early childhood largely contribute to the way they interact with and relate to others in adulthood and the formation of their own attachment style. Research showed that parental mental illness during the early postpartum period may have negative effects on attachment formation because of impairments in warmth, sensitivity, and predictiveness of parenting behaviors. The term maternal-fetal attachment (MFA) describes the emotional bond between a mother and her unborn child during pregnancy. Crowley originally defined MFA as the extent to which women engage in behaviors that represent an affiliation and interaction with their unborn child, and emphasized the establishment and strengthening of a unique relationship. Building on Crandall's conceptualization, Murles proposed that the definition of MFA should also involve the thoughts and fantasies expectant mothers have in relation to their unborn baby and their pregnancy. Conversely, Condon proposed that MFA was driven by a mother's disposition to know, protect, interact, and meet the needs of her baby. Despite the difference in definition, theorists and researchers agree that MFA is a multidimensional construct that includes maternal thoughts, behavior, emotions, and attitudes. Although less research than postpartum bonding studies suggest that the experience of mental health difficulties antenatally may impair mother's ability to form a close bond with her unborn baby. Possible explanations for this include lack of emotional resources, belief about poor suitability and competence as a parent, lack of maternal role identity, and negative attitudes toward caregiving. The construct of MFA has been identified as an important contributor to mothers and infant health, but the dominant focus of research has remained on postpartum mother-infant interaction. MFA research has considered a number of variables relating to well-being and mental health, including depression, anxiety, stress, coping skills, social support, partner relationship, and self-concept. Although it has been the subject of research attention since the 19th 70s across studies finding on MFA continue to be inconsistent, with previous review being unable to produce robust scientific findings. Furthermore, despite recognition of the first 12 weeks after birth as a particularly critical time for mothers and infants, a period coined the fourth trimester, there remains a focus on studies with either the antenatal and postnatal focus. Inconsciousness in how maternal mental health and MFA are described and measured, and the lack of a single operational definition and theoretical framework underpinning MFA represent two major gaps in the literature. Methodological discussion, such as the primary use of cross-sectional designs, has limited predictive abilities within studies, while disparity in assessment time points, small homogeneous samples, and variability in screening tools utilized has limited generalizability across studies. Although reviews have drawn attention to these concerns, they have not served as a catalyst for the future research that overcomes these weaknesses. Two recently published systematic reviews have attempted to address these concerns by examining MFA in relation to anxiety and child developmental outcomes. However, there remains a need to review studies on more global mental health construct and maternal outcomes.